A controversial treatment for multiple sclerosis could soon be available in Canada, and patients in Saskatchewan would be first in line to get it. Saskatchewan Premier Brad Wall says his province is willing to fund clinical trials for the so-called liberation procedure. It's a type of angioplasty that unblocks veins in the neck, and MS patients say it eases their symptoms. Right now, the treatment is only available in Eastern Europe. Joining us to talk about what his province is proposing is Saskatchewan's Premier, Brad Wall. He is in Saskatoon. Premier, good of you to join me. Thank you.
Thanks for having me on the show, Sue.
You're not a medical doctor, but I assume you've been speaking with physicians and the like regarding getting their information. What are you hearing from them about this liberation treatment?
Well, when news was first breaking about the liberation treatment and about the fact that a number of Canadians and residents of Saskatchewan who are battling MS were considering traveling to places where the treatment was available or had done so already, we obviously started talking about the issue in our government, in our cabinet. I talked about it with our Minister of Health. The Ministry of Health was discussing things with the research community at our universities, and it became apparent that there's some preliminary research that Saskatchewan has been involved in through our universities in terms of the diagnostic part of this, determining MS patients that might be a good fit for this treatment should it become available. And if the next step is to be clinical trials, I think Saskatchewan is well positioned to be in a leadership, to play a leadership role here. We have the highest incidence of MS in the country. And so we've had a number of patients and families that are advocating for the treatment. We want to be measured about it. We think a clinical trial is the right place to begin. And so what we're saying is that if the research community brings forward a proposal for clinical trials, we're prepared to fund it. We're prepared to fund those trials in the province of Saskatchewan.
There have been no proposals brought forward yet. I'm sure they're imminent given the fact that you want to fund them. Do you know, have a dollar figure on this, how much you're willing to put on the table?
It's such a hypothetical discussion on the dollar number, Sue, because we just don't know what's going to come forward from the research community. And you're right, we're reasonably confident we're going to have a proposal soon, and very likely from Saskatchewan-based researchers. And it will very much depend on the scale of the clinical trials, the numbers of them. But we're confident that what will be coming forward will be able to be absorbed in the Ministry of Health's budget and in the budget, the approved budget of the government of Saskatchewan.
Will it mean, though, in the approved budget, that you have to make a choice, fund these clinical trials, take away from something else?
It can't mean that. This is something we want to do in addition to what we're already providing for in terms of health care. We've been working very hard in Saskatchewan on an aggressive plan to reduce wait lists. I think we're going to see some good news on that front in the weeks ahead. That's still a priority. Long-term care is still a priority. But this is also a top priority for us. We do have the highest incidence of MS in the country, and I think it's important for Saskatchewan to play a leadership role in a measured and responsible way. And we'll take our cues from the research community on this, and I think we're going to be hearing from them soon on specific proposals.
Even the MS Society seems to be a bit divided as to whether this liberation treatment is actually that beneficial. Are you taking those thoughts into consideration as well as you decide how to spend taxpayers' money?
Well, we most definitely are. We know there's no consensus on this. We know that the medical community is not of one mind on the liberation treatment. That's why we're saying we're going to leave it to experts. We're going to leave it to the research community, some of whom have already begun significant preliminary research into this particular treatment and its application from a diagnostic standpoint to certain MS patients. We will take our cue from the research community and those that have expertise in the area, in MS specifically, and fund those clinical trials. But the bottom line here is there is some hope. There is some hope for alternatives. It's born of some anecdotal stories, powerful stories of the impact of those who've had liberation treatment. There's a growing body of case evidence as well that there's reason for at least some hope and optimism. We should be exploring that hope on behalf of those patients. We should be leading in this regard, and that's what we're going to work hard to do in a responsible, measured way and in step with the research community.
Now, next week you have a Council of the Federation meeting with other provinces and territories. Are you going to be bringing this to the table, perhaps saying, you know what, why don't you guys get on board as well? Why let Saskatchewan carry all of this?
Well, it's not going to be a formal part of the agenda, but I will be raising it with the premiers. There may be provinces that wish to join with Saskatchewan. We would welcome that, obviously. I think the broader scale approach is better, both to advance the clinical trials themselves and maybe if there is reason to move beyond that together. So But in the meantime, we're prepared to do the work here in Saskatchewan. We welcome all partners in this, and we look forward to any proposals that might be coming from doctors, from the research community, from the science community as well.
You know, I have one final thought, and that is that you're willing to fund this because the word that you've used a lot is hope. Is that the bottom line here?
Well, it is. I mean, we all know in Saskatchewan, almost everybody knows somebody, has a family member or a friend, or knows someone that is afflicted with MS. I think what we've seen as a result of the liberation treatment and even the anecdotal evidence of those who've had the treatment is that there is some hope. And there is some real reason to at least ask some questions and to explore the potential of this. And I just think that that's one of the advantages of a public health care system and a public university system. We can together, as a society, as a province, as a country, direct those institutions to ask those questions and develop those answers. That's an advantage of a public health system. We should be using it then to the benefit of patients, and in this case MS patients, but also families and friends and those who have loved ones that are battling the disease.
Premier Brad Wall of Saskatchewan joining us from Saskatoon. I want to thank you for taking the time. Good to have you on the show.
Thanks, Sue. All the best.